next thing is TURP syndrome. So I had this in my OSCE, where it was a situation where you walked in and you were basically expected to do an A to E assessment on a patient. It was a model, plastic model, and the diagnosis was TURP syndrome, and how would you manage that? So TURP syndrome is thankfully a relatively rare complication of TURPs now, so the transurethral resection of the prostate. It used to be a lot more common because they used water to as the medium for TURPs. So similar to laparoscopy, where you need carbon dioxide to be the insufflation gas, you need some sort of fluid medium to distend the bladder to allow you to visualize it, but you don't want it to be electrically conductive, because otherwise it will conduct the diathermy to all of your tissues. So it's got to be something that can't conduct and hence can't have electrolytes in it. So various things increase or decrease your chance of having TURP syndrome. But one of the ones that can, apart from the fluid medium, so using distilled water, the other thing that can sometimes contribute to it is if you have high hydrostatic pressures. So if the surgeon has their bag of distilled water very high up, almost touching the ceiling, then you're more likely to get sort of this transmural movement of water across into the bloodstream. The symptoms of this are easier to detect if the patient has had regional anaesthesia for their TURP. But yeah, you can see the sort of symptoms there. So the most common thing that is there is confusion and vomiting. But you can see that if it's not properly treated, it's similar to sort of severe hyponatremia and hypokalemia, and basically it can actually kill you. So it's one of those things to know enough about it to recognise it. But actually you wouldn't necessarily be expected to handle it on your own. You just need to basically go and get and ask for help. So since they switched to glycine as their fluid of choice, it has decreased the chance of this happening significantly, which then made me wonder why they didn't just use glycine in the first place. But again, we can't question the surgeons. The treatment of TURP syndrome is mainly supportive, so they might require intubation, particularly if they're very agitated. You need to correct the electrolytes. So it is a rapid hyponatremia, just a rapid decrease in your electrolytes. So therefore, you can rapidly correct your electrolytes. So you can give things like hypertonic saline in order to try and normalise their sodium. And you want to get rid of that excess fluid, which they've absorbed through the TURP. So it's also diuresis. So things like frusemide and the like. But obviously, that will also lose your electrolytes. So you just need to be rather careful about it. It's something that you would want to be doing on HDU/ITU, not on the ward. Let's put it that way.